Also happening today, the White House announcing a push to treat more COVID patients with antiviral pills. It's a rollout that's been slow. The medication had one authorization in December, so now the White House hopes to speed it up by making more pills available. But getting the pills may not be the issue here in Arkansas. THV 11's Mercedes McKay explains why.
Here at Marketplace Pharmacy, the owner tells me that inventory is not the problem at all. It's actually getting those pills and prescribing them to patients. And this new initiative doesn't solve that problem.
It'll remove one barrier. Absolutely having more places that can dispense the medication will be helpful, but it doesn't really solve the whole problem.
Daniel Cate describes it as a small part of a much bigger battle. While the government buying 20 million more doses of Pfizer's antiviral pill sounds good on paper, there's still a larger issue at hand.
That's great that supply is at a point where we can do that. Part of the reason supply is at a point where we can do that is because we haven't been able to dispense very much.
Many pharmacies in Arkansas, including Cates, have plenty of pills on shelves. But since the FDA blocked pharmacists' ability to prescribe the medication, the pills aren't leaving the store.
Due in part to how complicated it is, we've had several prescriptions and actually dispensed none of the medication for various reasons.
Part of the White House's new plan is creating more test-to-treat locations where someone could get tested for COVID and get the treatment all at one location. But that still doesn't work for our state.
Those are usually in some of the chain pharmacies that have a medical clinic associated with them, which we just really don't have that much access in Arkansas.
Nikki Hillier with the Arkansas Pharmacists Association says the biggest hurdle still is prescribing the pills in the time frame where the medication is most successful.
Access is not a problem. We have those available right now. They're sitting on shelves ready for whoever needs them.
Well, getting the meds to the patients is vital. Hilliard says it all comes down to saving more lives.
We've lost almost 1 million Americans, and we need to make sure that we don't lose any more because we have good treatments now.
In Little Rock, Mercedes McKay, THV 11 News.
Mercedes, thank you. For both brands of those antiviral pills, patients have to start taking them within 5 days of their first COVID symptoms. And that's why pharmacists believe that the lack of authority on prescriptions among pharmacists is delaying access.